Dr. Joel Kaufman. He's going to be talking specifically on the issue of wildfires, like cardiovascular disease and the vasculature.
So what do we know about these health effects? We know that there are acute, immediate health effects. We're learning about the possibility of acute delayed health effects, and then chronic health effects is still a bit of an unknown, but there is some growing evidence that we need to be concerned about it. Do we consider this simply based on particulate matter concentrations, or is the toxicity of wildfire smoke different from other air pollution? You will get itchy eyes, headaches, stuffy nose, and cough. That's just an acute irritation effect. There's been a lot of information on respiratory disease exacerbations as a result of smoke. But then this cardiovascular disease has really been what we've been learning about. Annual Reviews of Medicine from earlier this year, indicating that in terms of cardiovascular emergency room visits and hospitalizations, there is a small effect, but a real effect of about a 6% increase in hospitalizations following a wildfire episode. And some of the estimates have been substantially higher. So who's at risk for this? There's lots of groups, which include occupational groups. And clearly, people with chronic lung disease, cardiovascular disease are considered in these at-risk groups. And when the recommendations for what happens when there's a fire come out, those are the groups that are highlighted. The AQI is what you'll frequently learn to focus on. And then what should we do? I think the thought about air cleaners, air purifiers, and the use of masks during these episodes, particularly for the susceptible groups, I think is really where most people are coming down right now in terms of practice. I want to tell you a little bit about the AQI. The EPA and local health agencies will be using this for informing your patients. And so you need to know about it. It's driven by whatever is the highest pollutant that day. It comes with a set of instructions. If it's less than 50, that's good. And then if it goes up to high, and then there are recommendations for what levels of activity people should have. You should know that actually these change over time. And actually just this year, the cutoff for 50 was dropped from 12 micrograms to 9. Wildfire smoke exposures are increasing. There are more fires, longer duration seasons, and we're reversing the gains of clean air regulations in some areas of the United States. The health effects are becoming increasingly understood. In addition to the mucous membrane and respiratory hazards that are well known, we now are concerned about cardiovascular effects as well, and perhaps delayed cardiovascular effects as late as 2 weeks after the episode. Chronic effects, health effects are much less clear. The assumption that those health effects are like health effects from other PM sources. And people with advanced cardiovascular disease should be considered at special risk. And we don't have any reason to believe that these events are going to become less frequent. In fact, they're projected to become more frequent over the next decade.